Hello to everyone who watch us. I'm really today very happy because we have very special guests, Dr. Vitaly Mikryukov. He is for me like idol of unwanted pigment removal. In this field, I'm working also so long, but now let's do like this. Vitaly will introduce himself by itself.
Okay, thank you, Ella. I really appreciate you for your invitation. My name is Vitaly Mikryukov. I'm MD, medical doctor, and a PhD in medical sciences. I'm a specialist in laser removal with experience for more than 15 years. And I can show maybe some slides about me that you can understand why you need to trust and listen what I will say today. Is okay?
Yes, please.
Yes, because I think it's very important. Now there are a lot of speakers and social networks, and you need to understand who you will listen to and why you need to trust. Okay, I'm medical doctor and PhD in medicine. My mission is to make tattoo and permanent makeup removal safe and effective. There's a lot of high-level expertise, tattoo removal, expertise of specialists in this field. 14 years I have a personal practice in laser tattoo removal. I parted away from the very beginner cosmetologist to the owner of my own cosmetological clinic. I was speaker in a lot of conferences in different countries. A lot of specialists finished my online course about the laser removal of permanent makeup and tattoos. I work on different devices, best laser technologies in the world. And I think it's interesting. I make tattoos to myself and remove it totally to show this is possible without scarring, without injuries, and without any consequences. That's why I am talking about removal of permanent makeup and tattoos. Thank you for this possibility to introduce myself.
That's nice. So now it's my time, my turn. So I am Ella Sakalauskienė, non-laser removal master, grandmaster. And actually, I'm working in this field also for a long time. Very shortly, I introduced my diploma. So I'm general nursing. Even I finished art academy in Vilnius. Also, I'm beauty therapist. And of course, I have so much special educations related to beauty industry. Yeah, it's my maybe hobby, or it's help also to improve my knowledge. And also I feel really very well when I'm doing these procedures. So I also visited a lot of countries with my trainings. And yes, I am author of non-laser removal methods, some methods like fee removal, M removal. Also, I am experienced trainer in this field. I am doing trainings in permanent makeup. But also, what I need to say that I created very big community in the world who are doing a lot of professionals are doing non-laser removals, very successful. Even maybe 7 or 5 years before, it was a little bit strange field. Next thing, what I need to talk, is about my trainings. My goal is always to create the method which works very effective, but also is very safe. Even we work on high Fitzpatrick skin type, Asia skin, which is prone to have scars, so all this non-laser removal field needs to be very safe for the skin. And we will talk about interesting things, and my method is generated to work on the face and of the body. And we can remove, permanent makeup, microblading, and also with safety work on eyeliners, lips, and pigment migration, titanium dioxide, tattoo removal. Yes, it's my new field. I'm working now slowly on this field because it's very special field. But also we very successful work on fresh permanent makeup and tattoo removal. So Vitaly, I know that you prepared beautiful presentation, and maybe we will not talk about all these topics which now, like indications for unwanted tattoo removal, but, it will be very interesting, cases in our practice which we can talk about.
Yes, of course. I look to your works, the results, and this is really great results. And as you say, the 5-7 years ago, it was very strange field of chemical removal. And a few years ago, maybe 4-5 years ago, I think about the chemical removal the same, because it was very strange. It was not so professional, a lot of complications, and people don't understand how to use it properly. But the chemical removal exists a lot of years, and in reality, it's from 19th century, first mention of this method, that it's much more older than laser. But in last years, there are a lot of new chemical removal system, new substances, new products in this field are appeared, and this was like wave of popularity of this method. But a lot of people think this is magic, and this is something wonderful, and this can solve all problems. But a lot of specialists get a lot of complications. I think there's this problem of chemical removal, and I really hate this method, and I was blamed. But now I understand. Yes, but this is the same problem like laser removal, because as we discussed before, the chemical removal and the laser removal is only instruments. The laser and the chemical removals is only instrument, and all depends from the specialist, from his knowledge, from its professionalism, what result will be. It will be safe and effective, or it will be complications and injuries to the skin. That's why I changed my mind about the chemical removals, and your works prove this and show the result that chemical removal can be safe, effective, and it's really excited. I'm really excited. And
Thank you very much. I will interrupt shortly because in the past, manufacturers, they just produce a good, they said they produce very good removals, but they forgot, to make good trainings for that, or just to create a simple method how to use it. So all of us who started in this field, I remember you just get a bottle, you looking, description, here's nothing absolutely about how to use. So you need to create, to make like in fantasy, to take some tools, and do your work. So my beginning was from zero, I tell you. Or I can say from the worst thing, because we invited also one training in our country. It was 17 years before. And so what happened, this model got a trophic scar for a long time. So this beginning really for me was hard and not with the best memories.
Yeah, the laser removal is same. It's the same situation. A lot of people think that lasers do by themselves and everything will be good. You don't need to understand everything to know about all factors which are influence the results and the risks. And they think, okay, I will do something like pew pew, and everything will be fine. But usually it finishes with bad consequences, and a lot of people continue to do the same way. Okay, we can discuss about the characters, about the removal. My point of view that every permanent makeup master need to have both of instrument, laser removal and chemical removal in their services, because it's very important. A lot of people have a bad and old permanent makeup, and not so many women have clear skin without any permanent makeup. A lot of them do bad permanent makeup years ago, maybe 10 years ago, and now they want to make new one, in new techniques, in light techniques, in some very beautiful techniques. But old permanent makeup, it's a really big problem because the residue is contain a lot of pigment. Usually it's carbon black. It's like bluish black, and you can't cover up this with your new permanent makeup. This will be really a very bad result, and that will be a very big problem for clients, for you. And this depends from the physiology of the skin and the properties of the pigment. That's why I insist that permanent makeup artists, before do the new work, need to remove old pigment, old permanent makeup, to make the easy way to provide new permanent makeup and make the work beautiful. Without it, like there will be problems, and all characters, orange characters, yellow characters. It's not the solving of the problem. It's not solve the issue, because it's on the short term, on the short time. Okay, it probably can make correction, can make the permanent makeup warmer, but due to the organic pigments, usually yellow and orange correctors are organic pigments, are not so stable in the skin, and under ultraviolet radiation they disrupt. They yes, and the old one, carbon black, bluish black color, will will become visible, and it will look like a really awful thing. And there are two options. The permanent makeup master need to cover up such old bluish permanent makeup every maybe 6 months, and or remove it with laser or chemical removal systems. And the last one option is the best option, because it solves the main problem, the residue of old pigment. That's why I insist that everybody need to use it, and to prepare the skin of the patients for the new good permanent makeup.
I really like, all your topics. I'm your fan and following you always. And, actually, when I talk with my students, I always ask them, how long you like to be in this industry? If you are permanent makeup artist, and after 2-3 years, these ladies are coming back to you, and they like to make a retouch, to make this something new with new techniques. So the most important sentence also always is for them, that we need to learn all these techniques, because yes, we have many clients in our country already very good educated. They understand that this covering, and to make eyebrows style, it's already very old school, and we need to look for opportunities to clean it and to remove it. So many options we have in our country. Many people are using laser, professionals, they have good lasers in our country. But there are many, many problems when we started to see such cases as multiple layers, pigment layers in the skin. So it's really horrible to remove when you start to remove, and some colors are visible as green color. You will talk about it later, And I noticed, one nice thing, then you start to remove with removals, chemical removals. So with all multiple layers, you can remove in some sessions, It not will be like this, that you remove one layer, another layer with another session, It can be removed, all these layers, step by step, with all these chemical removals. But, why I also use these two methods in my career? Because sometimes, yes, it's better to start with removal, but to finish with tattoo, with laser removal. And it takes just maybe 4 sessions, Even it was covered with new generation of pigments. this is my style, how I work, but maybe you have other, cases, and maybe you can also advise for us. Yeah.
Okay. Usually I uh, teach my students and tell to the permanent makeup artist there are two indications for laser removal. The laser removal is supposed to remove good. It's a black color and red color. The black and red color is normal components of any brown ink for permanent makeup, because brown consists of black, yellow, and red pigments in different combination and different levels and different amount, and this give the different shades of brown, warmer, colder, and everything like this. And if you see a lot of black color, it's like bluish tint maybe, or gray color of old permanent makeup, it's really easy to remove it with a laser, because the carbon black, which I usually used for as a component of the brown ink, it's really best pigment for laser removal, because carbon black has the great feature. It's carbon vapor reaction. It's mean that under the influence, under the impact of the laser, it can vaporize and disappear in the moment, in the session. It's special property of carbon black. If you have enough power, enough energy, enough fluence of the laser, really you can remove it immediately in the procedure, and it's look like magic, but it's real, and it's easy way to remove old blackish grayish color of old permanent makeup. Usually it's cold color, and especially if it is old permanent makeup. For example, my mom had eyebrows permanent makeup for more than 15 years, and we remove totally it with one laser session. It's good laser. It was a really powerful laser, compact one, but it really was effective. In such case, I insist that it's better to use the laser. Yes, it's the best option because you can remove it totally. Another example, my wife. She has a few corrections of the permanent makeup and for different time periods, and her eyebrows look like gray color. I think it was very easy to remove, but we get the orange residue because in some time it was the correction. I don't know when and how she was get these correctors, but she gets such problem that we discussed before. And in this case, maybe we can use removal firstly, and then remove the residue with the laser. But it's not the problem. You can start from the laser, and this orange or yellow residue you can remove with chemical removal, because orange and yellow colors are really hard to remove with a laser. It's like threshold for laser. It's like problem for laser, because yellow color, orange color do not absorb the laser energy. That's why you need both of instruments, laser and remover. And in which step you can use different instruments, it's not so important. It's like it's a decision of the professional, decision of the client, the desire of the client, what he expects, what the professional have the experience in such fields, and I think the professional need to decide what steps he need to do first and next. But the main goal is to remove pigment and prepare skin and make skin clear for the new permanent makeup or for absence of permanent makeup, because some of clients don't want to make the permanent makeup in future. And I usually have two groups of clients. One of them prepare my skin for new permanent makeup. I want new one, and this okay. And other group say I never in future will make will do the permanent makeup. I hate it, and this it's their decision. the main goal is to make the clear skin, and what to do with this clear skin is decision of the client. Maybe they will do, maybe they not. But our goal is to make clear skin without complications, without scars, injury, and other traces of our procedures. I think this is main. That's why I think that laser and the chemical removal systems, it's not the enemies. Yes, it's like two instruments which work in the one field, in the one way, in the one goal. That's my vision of this.
Very nice to speak about this. Actually, few years before, I thought that just carbon-based pigments is better to remove with laser. But never, what you will find, because usually this black color is already covered by other new generation pigments, which, have this orange special, red iron, and other things. And then you start to work. And remember, a few days before, I also posted in your group the case when I started to work with laser on their black carbon-based pigment, and then what I found, completely red color under. So it was inversion. But what to do, So when I start to work with removal, I really extract all the pigment to the surface. During this procedure, you can see a lot of pigment also coming to the surface, and with the scalp also it goes away. And I prepare the skin also for that laser also after can remove in one session, But if I work on very old case, I start with chemical removal and later I finish, with laser. So it's my way. As you told, you can choose many tools, not many, but 2 tools for that. But next thing about decision for client, how they decide. I like just to do with laser or with removal. Maybe again, 5 years before in our country, everyone just was removing the laser because they didn't trust chemical removals. And I, in this time, was traveling to my trainings around the world, 4 years I was traveling, So I couldn't educate clients and professionals in my country because I was just travel. But when I come back, very soon, very quickly, I started to work in social medias and by explaining everything what I understand in this field, and what gives my experience. So today, many clients, they already choose chemical removals because maybe they see also very fast results. But one thing what they scare, it's scalp after procedure, the crust, because almost 1 week they need to go a little bit after, especially after first procedure, with a thicker crust. It's a little bit thicker like after permanent makeup procedures. So yes, some of them they choose laser because they thinking maybe it will help. But now in our country, so many people, so many clients, they are going with this green yellowish eyebrows, and they did already so many procedures. And as you told, choose pico laser, right? Okay, they choose pico laser, but it takes also a lot of time and several sessions until they get results, what they want.
There is some physiological logic in your method about the starting from chemical removal, because it's trauma to the skin, moderate, controllable trauma, and these trauma make the pigment particles to move, to redistribute
To the surface, yes.
skin. It's not especially to the surface. They redistribute, and possibly they can make like new agglomerates and become bigger particles, and it can be easier to remove with the laser after the amount of pigment particles will reduce and they redistribute it. And part of them, I think, will go in upper layer, and they maybe be more more and maybe they can be destructed by the laser with the easy way. It's physiological, they have this possibility. And this is maybe one of the way to combine laser and removal. But I insist that the chemical removal must be provided by good specialists with the good skills, with the good knowledge, because if I see so much cases with complications, not only chemical removal but the laser removal. And firstly, in my account, in my all my posts and all information that I provide in my channels, I first of all I blame specialists who make complications with laser in the first way, because it's my topic, it's my field, and I try to explain people this is the wrong way of using laser. This is not normal, not the safe laser removal. But the same situation in the chemical removal. People who don't understand physiology of the skin, regeneration, how skin restoring it after the trauma, they really go on the very thin ice. Yes, it's very.
Exactly. And still, people are working on different specific skin types, on different age people, And these cases with permanent makeup, you see just that skin is destroyed already with, all these procedures. You see atrophic scars sometimes, So everything is combination of your actions, and you need to be very educated, very good educated. But anyway, I also prepared, as you, very special study with videos and explanations how to perform this procedure, safety, not to be hurried just for results, because of course you can remove in one procedure, but after that you can get scar for a long life, And it's not our goal, To be patient, we need to educate also our clients, because they also like to get results immediately, now just. But this education needs to go through all the social medias, through all these articles. I prepared also now many articles. We are still in our local, place, but now we will go a little bit more far away, because this experience gives me also power, because I'm still working on many, many interesting topics. And I think so that it's time already to start with your presentation, because it's absolutely beautiful for permanent makeup artists to understand what is going with all these new layers of pigment.
Okay, I totally agree about the particular situation of particular client is every time is unique. It's skin type, it's skin thickness, it's the age, it's everything. It's a lot of dozens of factors are make the influence to the result and to the risks. And you can do the same technique, same work on different skin types. That's why you need a lot of knowledge, and you need the experience and know how the kind of particular factor make the influence to the result. It's really, and of course, the chemical removal and laser removal, it's not the fast solving of issue. No, it's a really long way. As I say to my students, if you do result, good, but slowly, people will remember that you make the good result and forget about this time, so that you make it slowly. If you make the fast and bad, maybe make scars or some injury to the skin, they forget that you do it fast. They will remember you do it in a bad way. You give a bad result. And this is the difference and approach of this. Okay, I will show, I have a lot of some illustrations, and I want to show you some photos of different cases which I met on my practice, which my students sent me. And this is how will look like the covering up of old saturated permanent makeup. If you will try, I want to warn permanent makeup artists. First of all, I want to say that I'm not against of covering up if the residue is very low, there is not so saturated. Okay, you can make cover up, you make new permanent makeup, and this
Exactly.
is no problem. Yes, it's okay. This situation is good for covering up. You don't need to make the totally clear skin and make a lot of procedures. No, okay, you can do this. But if you will try to do cover up in such situation, it will be a very big problem or such one. This is, you can't cover up such permanent makeup. And if you will try to, you will get something like this. I have a lot of these ugly, I think, situations, but it's really suffering real people. They trust to their permanent makeup artist. They trust that they can cover up it, and they think that everything will be okay. But usually,
Dr.
there's
Vitaly, I think so that all these permanent make masters, they need to have portfolio and to show always such cases and to avoid such clients which like always, to make something new on such tattoos, on tattooage.
yes, because if you will refuse client and say no, I will not do this. Usually, client think, oh, you are not so skillful, master. Maybe you don't know how to do it in the right way. I will go to another, and it will make it okay. But I refuse you. If I will be a permanent makeup master, I will refuse it not because I'm not skillful and I don't have a lot of knowledge how to do this properly. I know this will be very bad result. And usually such cases, clients get from the, I don't know what permanent makeup, unskilled newbie, or really do not responsible permanent makeup artist. Because this is a really bad situation. I will show you some more. Yes, like this. Look at this. It's ugly. It's ugly. You don't need to do like this. And I have another one. I think it's perfect masterpiece. That's why I against all the covering up all permanent makeup. And I want to show you the results, how it really need to be done. This is eyebrows of my mom, and this is on the left side the before laser removal. Yes, and the right, it's only one procedure. Only one procedure. It was all carbon black, and if you will try to cover up on the left side on before, it will be a very ugly thing. But on the right side, it's ready for new permanent makeup, and you can do in this such situation the good, very light work, and it will be very, very good. And here is case of my wife, because it's the last one case. You see, it was grayish, like cold grayish fade, cold grayish tint. And after laser removal, we start to see the orange corrector inside of the skin after we remove big part of carbon black. And can I explain how it happens? Because there are a lot of myths about that laser. It's make color changes and make the pigments become yellow, bright yellow, and it's all blaming the laser. No, in reality, the situation is like this. No, this one. Situation like this. It's like scam, and the first step, I will try to explain. This is first step. It's how the brown color ink are created. It's usually 3 colors in different combination, in different amount, black, yellow, and red. Yes, and after laser removal on the first procedure, usually remove black, carbon black part of the pigment, and then you will get orange, like orange color. Maybe it will be bright if it occurs on the first year after the permanent makeup. Usually you will get the bright orange residue because there are a lot of red and yellow pigments in the skin in this period. And after this, on the next step, you can use 532 nanometer wavelength, and you will remove the red part of the pigment. And after this, you will get yellow, sometimes very bright yellow residue, and it can look like this. Yes. It's a feature of modern organic pigments, which usually put a lot of yellow pigment, organic pigment, to make the color warmer for a longer time. They know this feature. They know that usually the color of permanent makeup of eyebrows become uh, grayish and more cold tint, have a cold tint, a bluish tint after the year and a half, or 2 year. That's why they put a lot of yellow to compensate such effect. And you see, here is a result. From the left side, it's right after the laser procedure, right? Before, without any laser procedure. And you see the bright yellow residue. That's because of the components of organic yellow pigment in the inks. And that's okay. And the another one, fish.
Vitaly, I just want to say that actually people are happy who have old generation pigments inside on the skin because it's so easy to remove. But the clients who has already new generations, oh my God, this is long story if you like to remove.
Yes. Because the yellow, okay, you can get the yellow residue, but the laser has no power about under it. You can't remove it with the usual Nd:YAG switch laser. If you will get yellow residue like this, you can't do anything with it with any laser. Not only Nd:YAG, not only compact Chinese laser, but very expensive, very branded, expensive picosecond laser, Alexandrite laser, PicoSure, or anyone, because yellow color do not absorb any wavelengths of commercial laser for tattoo removal. And this is the indication for chemical removal, because you can't do anything with the laser with it. That's why I insist that permanent makeup artists need to have both of these instruments, because if you will get yellow residue laser, it's have no ability to remove such residue. That's why. And that's why I'm against of such color correction. Such color correction, it's a very big mistake. And there are another one example. You see, this is classic situation. Organic pigments, black color, removed totally, and you will get the bright yellow residue. And the laser can do nothing with this. And you need to use or time or
Dr. Vitaly, yes. When I'm going to conferences and you can see sometimes speaker who teaches, how to cover, how to change the color, how to make it warm. So I really can't believe that we still have such speakers who teaches that, because actually it gives, for our client big problem in the future.
I think the people don't look in the future, don't think about the consequences of such. They so think about the short-term benefits. Okay, in short term, you will get the benefits, you will get warmer or something like this. But if your client will think about the removal, it will get big problem. And a lot of such trainers, such permanent makeup artists say and write to me that, okay, our clients do not want to make laser removal. They're afraid of it. They're afraid of scars, of blood, of injuries, and they don't want. And they ask to cover it up. And what we can do? We need to do something, because, or maybe in some countries there are restrictions for using laser for non-medical specialists, and that's why they choose to cover up. It's like from two options: not do anything and do correction. They choose to save the client, save the maybe income, or try to help such client, okay, with this way, with these consequences, but they choose it. Okay, I understand, but they need to understand the consequences of this. They need to understand all, yes, all facts, and tell about this to the clients, and the client need to decide, do he accept this or not, because they need to give all information, because it's really good politics to be the tell the truth to the people, what will happen in the future, and what will happen. But in my opinion, the yellow residue is okay. It's in the first year. It's okay. It's maybe very bright and it's make a problem. But another good thing that the yellow and orange organic pigments are not so stable. And if you will do nothing but wait for maybe 1 year or something, and if you live in a country like maybe Italy, Spain, there are a lot of sun and ultraviolet, this organic pigment will fade, and in like
Yeah, but we have some cases, we have some cases. Yes, because I watch my clients, I always, have good connection to my clients, So sometimes if they stop to do removals and they stay with this green color, after 3 years, it's still enough good visible. So it depends, on cases, of course, because
Yes.
each case is unique.
Yes,
Yeah.
but I have mentioned about from my students, from my graduates, that they achieve some like these results, yellow residue. They understand that they can't remove it with laser, but they see these clients after the half of year, 1 year, and they see that the yellow was disappeared under the ultraviolet radiation, and this okay, it's good. And another one option I want to say about when permanent makeup artists need to chemical removal in the first line, not laser, first line. It's about such situation, about covering up with the flesh color, with the white color, and other things. In such cases, you see, here is like correction with the white color.
Retails, for example. Yes.
Yes, there are a lot of such things, and like this. Like this. Even
If you, Dr. Vitaly, if you agree, maybe in the future we will have topic about titanium dioxide, because it's very interesting topic and we have so many examples everywhere, in tattoo art, also in eyebrows art. So we need to speak in the future about.
Okay, but I want to show you. In such
Yes,
case,
sure.
removal is contraindicated because you will get on the flesh color, on the white color, you will get the paradoxical darkening, and it becomes the green color. And the usual laser, which I used to for most of all permanent makeup artists, can't cope with it. And such case, you need to remove with chemical removal on the first line. It's like indication for it. That's what I want to say about this.
Yeah.
Yes, but I agree. It's people, clients, and permanent makeup artists need to be educated. They need to know about such features, such nuances, because clients trust to permanent makeup artists. Permanent makeup artists maybe do not put a lot of efforts to get some knowledge, and that's why the clients get in such situations. And this is surprisingly for a client, usually for permanent makeup artists, because don't make sense of it. They don't know that it can happen, but it's normal, usual thing that every permanent makeup artist, if she work in this field, need to know. It's like basic knowledge. Basic knowledge. It's not something something very complicated, but it's like I don't know alphabet.
It's Dr. Vitaly, I can compare, you have driving license, right? But you cannot make good parking because you don't know how to do it. And it's like the same thing,
You don't understand the signs on the road. Okay, you can drive. Okay, you can make
Exactly.
yes, but you don't understand what these signs I mean. It's like very big problem for you.
The problem is because there are so many fancy educations with gala parties and blah, blah, blah. But if you are going here, you sometimes, the speaker always repeat another speaker. But here, essentially, he cannot say so much because he doesn't know, absolutely. But he can organize very fancy trainings. That's why we have so many people who are really, they think that they are educated, but in reality, we don't have so basic knowledge about it.
Yeah, it's one. So I have one phrase. Um, it's like the main enemy of knowledge is not the uh, lack of knowledge. It's illusion of knowledge.
Exactly.
It's very big problem because someone has some training, and it's not make sense that this trainer not so good, not has a lot of knowledge, not so professional, but you think, okay, I passed this training, what I need to do to do something else, why I need to uh, learn something new. I passed the training, I know everything, that's okay. But really smart, good professionals learn all their life and learn everything and everywhere, and it's very important to make a difference between trainers. Not all trainers the same. It's very big problem. Now you have social networks. Now you have YouTube, Instagram, Facebook, and everybody have the place to talk about everything he want. But that's not the mean. This is the truth. This is the real knowledge. This is the real evidence-based knowledge. Sometimes people tell something and they don't know about anything, and they make it and everybody hears and they applause, and you sometimes you watch this and you really, yes, you really mean it, you really listen this spell, and what he say, it's totally shit. I'm sorry, but it's really now it's very big problem. But it's I think it's very big problem with a critical mindset about the critical conscious, maybe. I think people
But we
don't.
need to speak. We need to speak because, people are really thinking that to come to permanent makeup field is really just for pleasure. It's hard work at first, you need to really to have absolutely good basic training about coloristic, about everything. Pigmentology is the main thing also. Technique is the one thing, but about pigmentology, people, they need to know much more because it stays in the skin. Manufacturers, they say, oh, it disappears during 2, 3, 5 years. No, it's absolutely not true. You'll find remains all long life, in the skin of this color. So we need to always to think what will happen in the future after 3, 5, 10 years. Always.
Yes, and there are a lot of fake pigmentology too. I'm really watching some accounts and some trainers. They really it's really fake. It's they don't know nothing, and because it's now the pigmentology, it's not the like science that exist a lot of years. No, the information is very fragmented. It's really you need to find the sources, evidence-based science articles to understand, and it's a big work. It's and there are not any book about the pigments or inks uh, in permanent makeup or tattoo. Nobody wrote it. It's a really very fragmented information in different sources. But somebody, I think, make fantasies, say it's fantasies, and it's people are absorb this information, and it's very hard to um, put the right knowledge in their heads after this, after such situation when they absorb really fake information. It's very big problem. That's why, okay, what can I do? I make a lot of content.
Yes.
Everything that I talk in my reels, stories, posts, everywhere, YouTube, everything that I talk have the evidence based sources. I don't even tell something like I don't know exactly. I don't have some proofs or some articles, some research, and okay, that's what can I do? I try to
No,
make a
you're
lot of.
doing very well. Absolutely everything because not so many people are doing like this. I'm a little bit working underground because I'm working with my students in the groups, but I'm not working so much in social medias. I just started, because I don't know why, but I like to do a lot of procedures because I'm still going forward, with all these methods. how to remove unwanted pigment, and how to combine laser, non-laser, for example, acidic removals, alkaline removals. I like to try everything. And just this few years, I really think that I can already go official to social medias to start, because I already proved many, many things, and even I still working, on some special cases. But today I am a little bit more brave, because results show that I can do it already official. I'm a very responsible person, very responsible, believe me. So that's why I'm here with you. I'm discussing. I'm really enjoy our conversation, and I think so that we will show for our watchers, for our attenders, everything what we like to say today. But we will continue. I am sure in the future with many, many things, many topics.
Of course.
So maybe we can go to my presentation shortly,
Okay, with big pleasure, I will look to your works and your presentation.
Yes, we will switch off again later, to yours, but I just like to show what indications now I work, So it's this short thing, just to say about that. I started, of course, from eyebrows, because eyebrows are most popular topic, and people are, they need to have a lot of, brows removals. Just later, I started to work with eyeliner, because I am a person, when someone tells that is forbidden, is impossible, I need always to try, and I get results, because I'm going not like a blind, At first, I think how to do it safety, and later what removals can give me the best results. If something it's not enough, I still have my bottles, I'm making some mixes, and after that, results are coming. Good. So just a little bit to introduce what removal can. It's new generation of removals. We can say this because we worked during COVID time on that. So now let's go a little bit with. So, of course, the best topic is how to remove eyeliner, and I'm happy when someone still is wondering how it's possible to work on migration or old permanent makeup. So some procedures are really medical. I work very safety and sterilize absolutely everything around, because I'm going to blood vessels with special tools, and I remove like that, working with tweezers and more special which we use as in surgical cases. But what indications? As you see, eyebrows removal, carbon-based, iron-based, sometimes you don't need to remove to zero. It doesn't matter. Also, as you see, this green color and multiple layers on the skin, many, many things which are for us very important. Just this year, I said that I will work on small tattoos, and you will see also some cases, because tattoo field also is very problematic, and I'm sometimes worrying in the same field, for example, eyebrows removal. I see that I get already good results. I'm going somewhere which is, again, still a little bit attractive for me, that is a little bit dangerous, maybe difficult, and it's my style, nothing to do. And next slide, I will show again that, yes, and removal can remove all colors. This is true, and it's very safe to work if you know how to do. Yes, when we say it's very safe method, if you are going to this method and to this training, we wish to properly to learn, all these techniques. What I notice, you can't leave your students after training, after live training, for example, right? You need to catch them in your hands, and educate more longer time, in all this group, as you are doing, So
Support is very important.
exactly. Because, people sometimes scare, and each case, as I told, is very unique, and people, they need more advices, because it will be, as I told, skin conditions, different age, Fitzpatrick's, everything is very, very important for all these procedures, as yours too, And of course, we can go to another slide, please. Multiple layers of removal. Here we will have, yes, very bad cases, but I work with my clients too. I educate them to be patient and to wait until my results. You see, also some students are working very successful. This slideshow was made very quickly, and I see still missing some pictures. But anyway, what I need to tell, I educate my client too. Before procedure, I tell, if you want to get rid all this color, it will take maybe 3 procedures, maybe 4 procedures. And it's my choice. I choose, the way how I will remove to 0, for example. If I will cover, okay, it's enough, to see some shading in the skin. But some people now, they like to remove to 0, so you need to be careful. And I later a little bit will show for you some cases how I am working, just okay, maybe we can go with one slide more, and after we will come back to you. Okay, green eyebrows removal. Yeah, this case is really for us very interesting, and my students also working in different countries on that, and the green color is different. If, for example, it's will be carbon-based pigment covered with titanium dioxide, it will be also green color, it will look like, but it's not in reality green color. So some cases takes for me just one session. But some cases, yes, it takes 5 procedures to remove to 0. Okay. Next one, carbon-based. As we told, it was also decided a few years before that it's cases for laser. But I decided to work also on carbon-based pigment because it's very interesting always for me, this. And yeah, it works very well. But if I see some small remains still in the skin of the color, yes, I do laser too on the top. No, then I get what I want to get, Good. Now it's time for you, because you have more slides.
Okay. I will show.
Not wondering what I show. I just, show just simple cases, Some cases, of course, we are not simple, but then you look to results. Yes, it's okay.
Yeah, it's really good and very impressive results. And I was interested in, I want to ask you, but you answered before about are you combining it with laser or only with the removal? Because on the last stages you use the laser, yes? As I understand.
On the last, yes, on last, yeah.
Yeah, it's really very great results, and it's like another side of the removal. Yes, because I don't see a lot of cases, good cases of chemical removal, because usually it's like complications, and I don't see a lot of examples. Now I see, and I see this is really good. And I want to show you a little bit results of laser removal. It's really good. Such situation, this one of my students, has all branded top lasers, Pico Shore, Pico Plus, Spectra, Electronic, all of these devices he obtained and use it. And you see, this is all carbon black, laser removal, one procedure, and this is a really good result. As you see, after the removal, you can make new one permanent makeup, and this is really good. This is old carbon black residue, and this is my student from Israel, and it's had a very good results, and I am really proud of. Here it's the result of 3 procedures of laser removal with changes in color because of the sort of components of the inks, but the final results, it's really good for a new permanent makeup, and this is possibilities of the laser like this. Before, after, 3 procedures, and it's really very good. And here it is, it's one of my students, combination of laser and chemical removal. First 3 photo, it's laser. When she get the yellow bright residue, she changed the method to the chemical removal, and after the 2 procedures of chemical removal, she get almost clear skin and ready to new permanent makeup. This is a combination of laser and chemical removal when you start from the laser in the normal way, and this is okay. It's one of the ways to achieve the good result. It's you can choose wherever you want. And here is, I think this was laser removal, and I have bad photos of complications of laser. I can show to somebody.
Okay, you can also later also include.
Okay, I can show you. I want to audience understand. Okay, we show you good result. It's look like very easy to achieve. It's look like, okay, one procedure, 2 procedure, hop, laser, chemical removal. It's so easy. Okay, I will show you what can happen if you don't understand something, if you don't understand this field deeply and don't understand how to use it properly. Okay. This is laser. This is laser in unprofessional hands in when people do not understand how to use it. Here with complications, it's look like, okay, it's like whitening, but I see here the total destruction of the epidermis. It's a thermal trauma, and this will be very big problems and maybe the scar formation. It's like this, crusts after laser. It's not normal for laser removal. It's not...
like after chemical removal, right? Mm-hmm.
Yes, and like these blisters and very big edema, and this is not normal too. And I want to tell that permanent makeup artists in a really good position because to get complications with laser removal of permanent makeup of eyebrows, for example, it's much more harder than with tattoo removal. If you will work with tattoo on the body, it's much more easier to get complications and get some problems. And that's why the permanent makeup artist in the really in a good position. And but even in such situation, they get complications. It's like they make efforts and get them, because they don't understand totally what to do and how to use it properly. Even such cases with blood, with crusts, with scars, and like this. This is consequences of improper use of laser. And if you understand this field deeply in laser removal, in chemical removal, it's look like easy. It will be good instrument. But if you do not go deep inside of this field and take efforts to achieve the expertise, the professionalism in this field, you will have a lot of problems, because the laser is a fourth class of danger. It's most dangerous the devices in cosmetic devices field. And the chemical removers, yes, it's aggressive.
Absolutely, I agree with you. This is also the same, you know. It depends also on pH, you know, how low or high is, you know. And so, because I have prepared also some slides about.
Okay. And I only want to warn people, because it's look like very easy when we talk to each other and show, okay, 1 procedure, 2 procedure, like this is result, this is good. But in reality, it's need a lot of knowledge, a lot of skills to do like this and do it in the safe way and effective way. That's what I want to show. I don't want to scare. I want to warn
Exactly.
you don't get this. This is the wrong way.
When I teach also live or online, I always have one topic how to. I show also improper works, So with my slideshow, I will show also something else about removals. I don't want to show which the pictures we oftentimes see in social medias. I will show just from underground underground pictures which you can see somewhere else, but usually some of them will be showed first time here.
I agree with you. It's important to show the backside of metal and not to make illusion that it's so easy and simple. No, it's like in every profession. If you want to become the expert and the professional, you need to put a lot of efforts and time to become. And it's not, it can be,
but also we need to mention that we are in team with client, sometimes client doing also crazy things after that procedures, for example, in our procedure, we scratch the crest, and this also big complication for healing, good healing. But anyway, I always advise for my students not to work too deep. This procedure needs to be short as it possible, don't try to go very deep in the skin, even if you work on tattoos, because body healing absolutely is different, and people now we understand how to work, but some of them we are doing still crazy things. So as you see, we have also a lot of complications, even we are teach and trained somewhere, I don't know, but there are some places on the face, like tails of eyebrows, they are really they have many risks.
And you need to mention that the skin on the face, on eyebrows, on the lips, around the lips, it's very good, have a very good blood supply and have a good regeneration potential. Yes, and even in such situation, you can get such problems and complications.
Exactly. Yeah. Okay, thank you for this slide. And I need also to destroy one myth about eyeliner removal. Still, we come back to one topic, The thing was, when I started to post in social medias, international social medias, these pictures how I remove eyeliners, it was maybe 7 or 8 years before. So I got criticism, highest criticism as is possible. I was like a crazy woman who is doing crazy things, and impossible things, and maybe unprofessional, like, if you don't know how to do, people are thinking that it's you are doing it just for yourself. But I was very calm. I explained to everyone how I'm doing this, and after half year already I got many applauds. And after that, of course, I was invited to work with many academies to just introduce these techniques to underwear brand, But now, yes, this one slideshow I like to show, We have a lot of situations for eyeliner. For example, after blepharoplastic, yes, people, we really have, some situations that eyeliner get very bad shape and you need to remove as soon as it possible. I am doing after 2 months after this procedure. And some cases, it's very easy just to remove some details from this eyeliner, or sometimes you are removing just shading. It depends on case. But it's so easy to work, unbelievable to work, even you work on lower eyeliner. Because you control quantity of a product, you're working with micro brushes, so this pigment has now multiple layers usually, This just one tattoo which made maybe 10, 15 years before this eyeliner. So you can destroy this pigment easily in the skin. And so with your tools, you can sometimes mechanically remove from the skin. And Yes, healing in this area absolutely is very fast, very proper healing always, no complications, no scars. Even sometimes students who don't have good experience, but they are good trained, after 2 weeks or 3 weeks, they are doing already eyeliners and we get beautiful results. So we really are proud in this field, that we can educate people how to do this tattoo removal. Yes, this is tattoo because this long commitment, for long life. Good. Thank you very much for this slide. Now we can continue a little bit about other topics which are really important for you, Vitaly.
Yeah, I agree about the eyeliners and plastic surgeons like this area very much because of its blood supply and its regeneration. It's really scarless, almost scarless skin. But I warn my students even when they work with the scleral shields and use the laser on the working with eyelids, with eyeliner, and because it's not impossible. It's has higher risk than other areas. But if you are good professional, if you know what you do, and this is, it's possible you can do this if you control, if you take this risk on you, if you discuss all risk with your clients and everything like this, it's possible. But I warn usually the newbies, the specialists with a lack of experience, not try to start from it. It's like this. It's you need to have experience. You need to have really a lot of experience to start to
Experience,
do
yes.
this. Yes, because if somebody with no skills try, okay, I will do this, it's really very big risk because even if it be laser or chemical removal, this is the very like sensitive for area in the eye. Eyes are it's really very risky zone. I want to warn all specialists not to play games with this and work only when you're really confident with your skills, with your knowledge, and you know what to do and how to do. That's okay. That's you can do this. A lot of people do it with laser, with chemical removals, but not unskillful. Please do not start from it if you don't have any confidence in your professionalism. It's not the best thing to do. That's what I want to say. Okay.
I agree with you.
Yes,
but
yes.
I also want to destroy this myth that it's impossible to work with chemical removals around the eyes. No.
Risks is increasing, is very high. But if you're a skillful master, skillful specialist, okay, it's possible. It's okay, but only in the case of your really good skills, knowledge, and professionalism.
Exactly.
Yes, that's what I want to say. And I teach my students the same way. If you're not confident, if you're afraid, if you don't know how to do this, if something you not have confidence, please do not do this. It's the best decision not to try, not to play games with this field and with this area. It's not a good idea.
Okay. So I don't know who will be next, you or me, because you have still slides, right?
Yes, I have a lot of slides. I prepare for any case, and I have about the tattoos. And I agree with you about the tattoos. The both instruments, both tools, laser and chemical removal, is much more risky in the skin of the body. This is surprising to a lot of specialists, maybe, and the client. They think that the face is more responsibility, and this is like more valuable, and on the skin of the body it's not so hard and not so not so responsible thing. But the situation is controversial. It's much more risks when you work with the skin of the body, and both way laser and removal, much more complications. specialists get when they work with the tattoos on the body. It's
Exactly.
pity, but it's true. Yes, and it's a lot of
Vitaly,
situation. Right?
our students, they think, okay, I will try to start my removal career on the body because, it's body, nothing. This is not a face, it's not official place, location. And we start to do, of course, very crazy things because we are relaxed, very relaxed. And of
Yes.
course, results sometimes they are not so positive. And I always say, please stop, okay? When you will be experienced with permanent makeup removal, then you can go to work on the body, because on body to work, oh my goodness, you need to be also not only experienced, but you need to have already have made maybe 20 or 30 some removal procedures.
Mm-hmm. Yes, yes, and sometimes my students sometimes bring me photo of tattoo that they will remove with the laser,
Yeah.
and this is the most risky situation. They give me a photo like a young girl had on the tattoo black saturated tattoo on the wrist, and this is will be my first work. I say, please let her go. Please don't start with this. It's so much risk. It's very thin skin, a lot of pigment. You have no experience. It's your first client. The probability of complications is like go to the moon in such situation. Please don't do this. I know this. I see this situation very, very clearly, and they don't understand the difference between the like saturated tattoo on the wrist or old unsaturated tattoo on the shoulder. I say find some guys with a 20 years old tattoo that they made in army. It's not professional. It's old. It's faded out now, and you can do anything you want with this without any risks. It will be good practice for you, and everything will be good. I tell now about the laser, but not the young girl with a saturated tattoo on her wrist. Please let her go with the skin, and you can work with her after maybe few months or few years of your practice, and you will understand why I warn you like this. And I agree with you that the chemical removal on the skin of the body is really very risky. I have some account. I look at them. It's like tattoo away. Maybe you know the
Yes.
system. They remove partially, and this is makes sense. They understand something that they don't need to work on the whole area at the same time, and they make it by the spots. But I think they don't understand. These spots are become scarce, and they think this is good result. They agree with this. They think this is the best result. I don't agree. They make the scar of the skin and think that the way they remove. Yes, but they try to use this physiology of skin, try to make the small areas, but they don't understand it till the end and don't use it and don't.
But another
use-
thing is, I really hate the things that, for example, we some people, they use blurry photos, yes, and they show that is good result. You cannot see skin structure, absolutely nothing,
Yeah.
but it's shown like really very good results. But then you see hypopigmentation already, you see some shadows, but also you can notice that here is some skin structure changing, pathological changes. So that's why I think we need to be very fair in this field. In every field, we need to be very fair. And I have a lot of videos, for example, if people like to see the picture, because when healing starting, your client always sending pictures. Sometimes if result is good, we don't come. But I have some tricks, and I invite them always to do something, because I need to have a proof that I did it very well. So I give some gifts, discounts and blah blah. Please come here to make pictures. So if someone, for example, you will ask me to give me some proofs or videos or blah, I have, before before procedure usually, and always after, because this is the main thing. And I started to do it maybe 4 years before. Maybe I don't have 7 years before, because it was maybe not important for me. But now, in this crazy world that I see so many fakes, pictures, I started to do this because if someone will ask me, I will give feedback, about it.
Yeah, it's very important to show the results and show the photos in good quality. Yes, because
Yes.
sometimes we really see such photos before, after, and after. It's like they make the photo on this one, like without any quality, without any focus, any light, and you can't see really structure of the skin. And sometimes you have some things. Maybe it's not so clear here because
This is
it's
true.
really good portfolio. It's very important for the master, for the specialist to show the results. And but okay, people sometimes don't think about it. They look to the photos from Google and think that this is the work of this master. A lot of cheaters and in this field, in this industry, and but I think they don't have good practice and the good. Uh, English is not my native.
No problem. No problem. Sometimes I also.
When you talk of time, like first hour, I'm tolerate English. It's okay, but after this, my brain is become overheated, and sometimes I forget some words. And it's like hard for me.
It's not a
Okay.
problem. Absolutely. We will improve everything what we talk now here. I understand you, and I also, because it's our first meeting with you, we talking about different techniques. I just want also to show how removal healing after this procedure. It's slideshow very quickly, so you will see in reality how does it look, and maybe someone also will be interesting about.
Of course.
Yes, how does it look? Because sometimes people, they are scared, to do this procedure. They are thinking that the picture, it will be very horrible. Of course, these healing pictures are sent by the clients, but anyway, you can see very well everything. Some healings on young people are very, very fast, just 1 week, and you get already results. About eyeliner removal, you see some swelling appears, but it's absolutely normal in some cases because people are sensitive, in this area. I need to say that sometimes aging skin has more swelling as young skin, mostly. This is my experience, So I just show what I wanted to show, and thank you very much for this slide. As you see, it's not so long healing, but on tattoo removal, of course, we have absolutely longer healing. It depends on what the location is, especially on legs healing is, oh my goodness. It takes time if you want to see good skin structure. And okay, so it's about healing. Yes, as I told we are in team with a client. So I, with my client, have very special connection always. I always say, please send me picture after 1, 2, 3 days until it will be scuffed away, because I like to see what is your hygiene. Maybe you have problems in healing, and I can help, with some ointments, maybe some advices, So I control by myself. Even I take this hard work, even I take, but I am always, I want to sleep very well, because I am sure already that I put all efforts to make the healing very fast, very successful, I control it, and some my students, they also learn to do it, because after that they just can be sure that healing was very good, and client didn't make any bad things for the skin. We didn't go to sauna. We didn't go to swimming pool, to sometimes to the gym after first, 2-3 days, and or don't go to the sun, or the rest in the right place and still on the skin, and all these things are very important for us.
The same, Laser. I explained to my students, yes, because you can provide a good procedure, make everything in proper way, but if your clients will not follow your recommendation or make something wrong, all your procedure will go in the trash, because they can get the complications very easily. And it's very important to give the understanding of importance of these recommendations to the client. This responsibility is on the client, and you will need to give it to them and say, you come out from my cabinet without any complications. All other situation depends on you, how you will follow my recommendation. If you will follow, if I will control, and you will give me some reports, photo, and will be in in connection with me, will give me information about everything, will be good. But if you will do on your mind what you want and go to the, as you see, sauna, the same situation. On the hot, you will go to the gym and make some physical aggressive maybe exercises, and everything can go on the wrong way. And it's very important to give such recommendation and such responsibility to the client, because the half of the work, or more, maybe more, is on the side of the client. It's very important, and they need to understand this, because you can do excellent work, but they can all your efforts and by not following and do something wrong in the.
I still remember one case, I did eyebrows removal. It was 3 tails, and she didn't send any picture for me. And after 2 weeks, she's sending finally the first picture. And I see here is absolutely no healing, because she every day applied, thick layer of powder, everything, makeup, She was in Cyprus, in the sun, she's doing crazy things, and still no healing, absolutely. The lymph is still leaking, everything like that. Oh my goodness. So what to do with such kind of clients? Nothing, You can do nothing, absolutely. But we have such some cases, yeah.
I make advice to my clients. You, on the first consultation, on the first contact with your clients, you need to understand what type of client you have, what type of person you see, and did this person interested in the result? Did they understand? Did the expectation is real? They expect real things. They don't have fantasy, something like this. And this is decision of the specialist to work or not to work with such clients. Some type of clients you better not to work, because you understand on the first step this will be problems with these clients due to they don't understand and don't want to understand. They live in their fantasies and they want some fantasy results, and they don't listen to you, don't pay attention to you, and don't maybe not trust, but not
don't take attention to your all rules after procedure.
Don't really take into account, and don't take it seriously. And this is the problem. It's like one of contraindication. The absence of
serious contraindication.
Yeah. That's why it's maybe become a big problem. If they say to my students, if you feel that maybe something wrong with this client, it does. Yes, it's really, it will be. You will know later. But it's not a good thing if you have intuition, and you need to trust your intuition. And if this usually you will get such problems with these clients.
I think so, that I have this intuition from the first message when I get, but sometimes also I'm making mistakes in decisions.
Yeah, well, but if you have a lot of experience with people, it's maybe thousands of clients, you really can understand even on the first message or on the first maybe talk on the phone. You understand almost everything about this client, and your intuition tell you that you don't need to work with it, or everything will be okay. You can work with this client, and you need to listen your intuition. It's very important.
Yes, absolutely. Um, I don't know. Do you have some more slides still or topics?
I think it's not maybe so. In our topic, I have a lot of tattoos, different complications, but I think we talk about everything, and I think it's okay. Well, I don't
I
know what about timing about the
I
topic.
think so. I think so. If we will have still, if we will decide, in the future to make still one session more, we can talk about because it's very interesting topic. Absolutely. What
Yes,
do you
we
think?
can. I think yes, we can discuss and maybe make some like maybe plan of topics so we can
Exactly.
provide the light. Yes, we can provide it and plan it and schedule
Now
it.
it was potpourri about everything, but just a
Yes,
little
it
bit
was
we talk about.
first experience. Yeah,
And
first time.
exactly. Thank you very much. It was really a big pleasure, a honor to be with you together in this special conversation about removals. And of course, we like to invite, as you know, you are already invited to the first M Removal conference, which has goal to connect all these beautiful people who are working in tattoo removal field. Doesn't matter, laser removal, non-laser removal. So as you see, these speakers, first speakers, we have more already, and we will insert a new slide here. But what I want to say, all they have already experience in this field. And actually, as you see, they are coming from different countries, will be from Arabic countries, will be some from Germany, from Lebanon, from Vietnam. And so they have different experience in this, but we truly believe that now started the time that everyone permanent makeup master, they need to learn both techniques of non-laser and laser removals. And later, when can work successful a lot of years in this field. Do you agree?
Absolutely, absolutely agree. And this uh, really very important to be professional in both of these fields. If you will work with this field, I think you need to become a great professional or don't work in this field. This is my opinion. I think it's great. And thank you. I very appreciate for the invitation to this live stream and the invitation on this conference. It's a very big proud for me and a big honor for me to be the part of this conference. Thank you very much, all.
Thank you too, Diane.